All right, well, I'm glad I get the first slot after the break because everybody's caffeinated and ready to go. I'm really glad to be here. My name is Esther Sherrard. I work in the Child and Family Services Review Unit in the Children's Bureau in Washington, D.C., and it's really a pleasure for me to be here with you. I've heard that there's been a lot of energy, a lot of excitement in the group, so I'm really happy to be here with you today. What I'd like to share with you this afternoon is some information about how the findings from the Child and Family Services Reviews are being used to inform program improvement efforts and sustain ongoing continuous improvement in child welfare systems. So what I'd like to do to start that off with is give you kind of an overview of the findings from the 2007 and 2008 reviews. Our second round of reviews has just been completed. We just had the Washington review a couple of weeks ago, so our second round is finalized, but we haven't finalized or published all the findings from the remaining years. So I'm going to focus the information that I'm presenting on the 07 and 08 CFSR review findings. So 32 states were completed during those 2 years, so just keep in mind that the findings represent those 32 states. Okay, the CFSR looks at 23 different items that evaluate safety, permanency, and well-being. These items are distributed among 7 different outcomes, and you'll see in this slide the average percent achieved for each of those outcomes in the 32 states that were reviewed in those 2 years. The outcomes are listed for you in your notes. There is a lot of information, so I didn't want to put everything in the slides, so please refer to your notes if you're not familiar with the items and the outcomes. You'll notice that permanency outcome 1 and well-being outcome 1 are the lowest rated outcomes, so we'll spend a majority of our time today talking about these 2 outcomes specifically. And before we do that, though, I do want to point out a couple of other key findings that we've identified as we've looked through the information that we've collected through the reviews. The first is the differences that we've seen in serving mothers and fathers. And this slide shows you across several different items, and the items are listed for you in your notes, the significant differences that we've seen in performance for service to mothers versus fathers. This difference has been fairly consistent within the round 2 reviews, so not just in the 07 and 08 reviews, but as we've continued to see this significant difference, and that has really informed a lot of work around father engagement, which we'll talk about a little bit later. The other key finding I wanted to point out is a difference in performance for in-home versus foster care cases. As you know, our sample includes both foster care cases and a sample of in-home cases. And as you'll see depicted in this chart, in every outcome across safety, permanency, and well-being, the in-home cases have rated lower than foster care cases. This finding indicates the need to pay closer attention to how families are being served in in-home service cases to ensure that children are being safely maintained and that families are receiving the services that they need to strengthen their ability to meet their children's needs. I wanted to draw particular attention to this finding in light of the trend that we've been seeing. I know you had a presentation earlier from Valeria Fajardo about the trend in the decline overall in foster care entries. So keeping that in mind, that states are moving toward trying to preserve families and do what they can to prevent foster care placements in a safe manner, I think we have a tremendous opportunity to preserve and strengthen families with an increased focus on in-home service cases and how we're delivering services to those families. And I'm really excited about the new resource center that we have to target that work. They didn't ask me to make a plug for them, but I just thought it was a perfect opportunity. Okay, before we go into the specifics about the permanency and well-being outcomes that I highlighted earlier, I do want to talk a little bit about safety because that is the priority for us in child welfare work. This slide shows you the 4 items that we look at that are reviewed for in the safety outcomes that are included in the review process. Again, the items are included specifically in your notes, and you'll see that item 4 is the lowest rated item in safety. And this item looks at the assessment of risk and safety throughout the life of the case. We've noted a few things that have contributed to lower performance in this item that I wanted to point out. Many cases have excellent initial assessments of risk and safety, particularly being conducted during the investigation stage of a case. And then as the case progresses, the ongoing assessments of risk and safety are what tends to decline. Typically, what we're seeing is a lack of ongoing assessment at key and critical points in the case as well. So when there are different things happening with the home, new people coming in, when there's a transition being planned for unsupervised visitation, when we're looking at reunification, and then at case closure, at those key points in time in the case, in the life of a case, we're not seeing that ongoing assessments of risk and safety are occurring. So it's really difficult to kind of ascertain what's guiding those decisions, and so that was a concern that we've identified. The other issues were related to safety plans not being appropriately developed and monitored, and this does relate again to that difference in in-home versus foster care cases. On the in-home cases, we're seeing that workers are not going out as frequently to monitor those homes, and so all those safety plans may be developed for those families in order to ensure that the kids can stay home. When the workers aren't going out frequently enough to monitor, there is concern that those safety plans are not adequate in keeping those children safe. So those are some of the key things that we identified in the safety outcome. Moving into permanency. This slide will show you the range of performance for each of the items in the permanency outcomes included in the CFSR. Again, the items are described for you in your notes, and you'll see that item 7, which looks at the permanency goal for the child, item 9, which is the achievement of timely adoption, and item 16, which looks at the relationship of the child in care with their parents, were the lowest rated items. So I would like to spend some time talking about the strengths and the concerns that we've seen specifically for items 7 and 9. Just as a side note, item 16, I think it is one of those items, a lot of times states even struggle in their statewide assessment about knowing what kind of information to provide for us around that item. And really what that looks at is, aside from visitation, what is the agency doing to help nurture and support the relationship between that child and their parents once they're put into foster care. So it's those extra things, allowing for outside contact and ensuring that they're still involved in the kinds of activities that they can safely be involved with their children, looking at ensuring that those things happen. And it really is kind of the extra. It's not a safety-related kind of practice issue, so I think it oftentimes gets missed in practice, but I think it does have a significant impact on overall performance for permanency, so I just wanted to mention that. So moving into item 7, again, this item looks at ensuring that permanency goals for children are appropriate for their needs, that they're being identified, the goals are being identified and established in a timely manner, and that the agency has complied with ASFA requirements for children who've been in care for 15 of the most recent 22 months. So the key concerns that we've noted in this area were that goals were not always established timely, and this relates not just to that initial permanency goal when the child's first entering foster care, but ongoing changes to the permanency goal that may happen over time, that those changes aren't happening in the most timely manner based on the needs of the child. And then the other concern was that agencies are not always complying with ASFA and filing for termination of parental rights or documenting the compelling reason not to do that within the prescribed timeframes. Then looking at item 9, and again, this item looks to ensure that adoptions are completed within the 24-month time frame from the child's entry into foster care. And some of the key issues that were contributing to lower performance include a lack of effective concurrent planning. And you'll hear me talk a lot about concurrent planning throughout this presentation, because we really did see how the appropriate implementation of concurrent planning really did promote positive outcomes for kids and families. So a lot of states have concurrent planning in their policies, they describe it in their statewide assessment, and then when we go out to do the review and we look at the cases, we don't see the evidence that concurrent planning actually took place. So some of the concerns around that, specifically, adopted families are not being identified in a timely manner. There's extensive time given to parents for reunification without understanding what the compelling reason is, if there is one, for not moving toward a termination. And this relates both to court practice as well as agency practice. So in some states, we're hearing the barrier from the court side that although the agency is recommending a move toward termination or alternative permanency goals, that the court is allowing these extensive extensions for parents. And then adoption goals not being established until achievement of termination of parental rights. So again, both on the agency and court side, there are some courts in several jurisdictions, I think, that will not approve a goal of adoption even being implemented in a case plan until they've achieved a TPR. And so that really kind of impacts the ability of the agency to follow through with a concurrent planning model. And then there are agencies also who have policies that restrict the worker's ability to identify an adoptive goal until they've actually achieved a TPR. Some of the other issues within this item are basically worker turnover, so the time frames are just kind of not being paid attention to as workers are changing and cases are being transferred, and just an overall lack of urgency in some cases on the part of an agency to finalize an adoption goal. So you have a child in their adoptive placement, they've been there, they're attached, they're bonded, they have their services, and so even though it's been more than 24 months or we're getting near the 24-month time frame, just really no sense of urgency to try to get that completed within the time frame. There are also significant court barriers that are impacting this, various continuances at hearings, lengthy TPR appeals, and then changes in judges or bench officers that kind of disrupt the flow of the case overall when the cases are being reviewed. Then the last two bullets relate to an issue I did want to spend some time talking about in terms of children's access to needed services being limited once the adoption is finalized. And we hear this from foster families and adoptive families as we go out on reviews, that there is some concern that once they finalize an adoption, they lose all the resources that they had as a foster family, or they're really unclear about what they can still maintain after they move into an adoption. And the same thing going for subsidies, that it's really just very unclear for them what the information is. Some of the workers are kind of unclear if they're carrying a dual caseload and adoption is not their primary case practice, and they have some unfamiliarity with what's available for adoptive families. So some of those things we've noted have been impacting the timeliness of achieving adoptions. Now that we've talked about some of the key concerns that we've identified in these areas, I do want to spend some time looking at where it's been working well. So what we've done is, within the 32 states that were reviewed, we looked at the top performing metro sites, the 3 top sites that achieved really well in these items, and tried to take a look at what they were doing that contributed to that stronger performance. So again, I've included information on all the items in the permanent C1 outcome, but I do want to just keep our conversation focused primarily on items 7 and 9. So in item 7, you'll see concurrent planning again. So here, these metro sites were able to implement concurrent planning very effectively, and that really did help to ensure timely movement of permanency goals and real close attention to time frames. So goals were established quickly, case plans were developed appropriately, and things moved very smoothly in those cases. And then in item 9, again, the concurrent planning really impacted this. There was timely filing for TPR, in some cases much sooner than the 15 months. So they were tracking the cases and documenting their reasonable efforts in such a way that they really were able to present an effective case to the court that proved that it was in the child's best interest to keep this moving. And then the goal of adoption was also addressed meaningfully in family team meetings. A lot of these top performing metro sites, we'll talk about this in the well-being outcome as well, had implemented kind of a formalized family team meeting process, and they were talking about the goal of adoption, what needed to happen to get the adoption finalized, who were the adoptive resources, what services could be put in place. So those meetings were being used to achieve timely permanency as well. And then the early search for adoptive families, which kind of ties in with the concurrent planning. And I've included item 10 information, which is part of the outcome as well. Then moving into well-being. This slide will show you the range of performance for all the items in the well-being outcome, and you'll see the lowest rated items are item 17, which is the assessment of needs for children, parents, and foster parents, and then the provision of services to meet those needs. And then item 20, which is worker visits with parents. So in this outcome, rather than focusing on the concerns, which basically the concerns kind of got summed up as needs weren't being assessed appropriately, services weren't being provided, and workers weren't visiting parents. So focusing on what we saw that was working well in these areas, again, we looked at the top performing metro sites and tried to get some information about what was working well. So in item 17, we saw, again, the formal team meetings being utilized. And there are various models: team decision-making, family team meetings. I'm originally from Hawaii, so Ohana conferencing was the model there. But really being effective at not only engaging families, which you'll see in item 18, this really helped to promote family engagement as well. But there was an assessment of needs. As the team came together, they were talking about the family's needs. The family was able to identify what their needs were, so that assessment and the quality of the assessment for not just the parents, but for the children and the foster parents who were attending was really, really effective. And then the team meetings enabled coordination between all the agencies and the various providers that were involved in the case, so that there was ongoing assessment and service planning discussions happening. In these metro sites, there were a wide array of services available, so I think that definitely impacted the overall outcome. They had the services available that were, when families' needs were identified, they could quickly match them up with the service that they needed. And then in the interviews with children, parents, and foster parents throughout the review, I think one thing that kept coming back in these metro sites was that they felt that their workers were responsive to their needs. So really a connection again with the quality of those worker visits with parents, and what were they discussing, and did the parent and the child feel like they could express their needs to the worker, and then were those needs followed up with appropriate services. I've included some information here on item 18, but again, we'll focus on 17 and 20, and again, just some of the same themes, the family team meetings. In item 20, worker visits with parents, there were persistent efforts being made in these metro sites toward frequent contact with parents, and I think that is the key. In a lot of the cases, it's not that workers are never going out to visit, but if they go out to visit and they can't find a parent, or the parent refuses to engage, it kind of stops there, and the case continues without any further engagement of the parent. So in the sites where this was working well, I think that persistence really paid off. There were repeated attempts to locate absent parents, so again, not just in the initial stage of a case, but ongoing efforts to locate, and then to engage non-custodial parents as well. These metro sites had a high frequency and quality of visits with fathers, so again, coming back to that issue I talked about earlier, the difference that we were seeing in services for mothers and fathers in the metro sites where they did engage fathers effectively, it raised their overall performance in the outcome. And then incarcerated parents were also visited, and that impacted the overall finding. I think a lot of times the incarcerated parent issue is one that workers are kind of confused about. They're not sure what the expectations are for engaging parents who are incarcerated, since they're not providing the home for the child. Why is it important? And so really kind of helping workers to understand those issues, I think, has paid off, at least in these metro sites that we reviewed. And then in these metro sites also, we saw that there was contact with parents, even if reunification wasn't the goal. If you were looking toward termination and you still wanted to promote the relationship between the child and their parent, that the workers were continuing to maintain that. And I think this goes back to the discussion we had on item 16, which looks at the relationship between the parent and the child. So overall well-being for the child, I think, is enhanced when these contacts continue. Okay, I do want to mention a few things from the systemic factors. The systemic factors are included in our review, so we don't just look at the outcomes. We also look at 7 systemic factors, which are included in your PowerPoint notes. These systemic factors are kind of broader issues that help provide a framework for the work that the agency conducts in achieving outcomes for safety, permanency, and well-being. So you'll see performance across all 7 outcomes, and the lowest performing were the case review system and service array. So I do want to spend a little bit of time talking about that. So in the case review system, we look at 5 different items. Item 25 looks at whether parents are being effectively engaged in developing case plans. And as you see, there's no state that we're able to get a strength rating for that particular item. In item 26, we're looking at periodic reviews for children in foster care. Item 27 looks at permanency hearings being held at the 12-month point. Item 28 looks to ensure that the state has a process for filing TPR within ASFA timeframes. And then item 29 looks at foster parent foster parents getting notice of hearings and being engaged and having the right to be heard at those hearings. Looking at item 28, the process for TPR proceedings in accordance with ASFA, some of the things that we've identified in states that have had higher performance in this item are that they've required that compelling reasons be put in court orders. So to ensure that they have accurate documentation of why they're not moving in that direction, they've worked with the court to ensure that they can capture that in the court order so there's clear documentation that meets the ASFA requirement. We've also seen states utilize their information systems, both on the court side and with the agency, to consider ASFA requirements and issue alerts so that everybody's mindful of time frames. So when children are getting near to that 15 months or 12 months in care, everybody's kind of aware that this is coming down the pike and this needs to be addressed. Some states have instituted specialized organizations within their court system to just handle those TPR cases so that there aren't continuances on those cases and things can be moving in a more timely manner. And then specific training for judges and parents' attorneys on what the ASFA requirement is, why it's in a child's best interest to consider timelines and the length of time in foster care. So some states have really paid close attention to that and engaged their courts in that kind of training. And then again, a strong agency emphasis on concurrent planning has impacted the overall findings for this particular item. Okay, then service array was the other systemic factor that had a lower rating. This systemic factor looks at 3 different items. Item 35 looks at whether there is an array of services that's available in the state to meet the needs of children and families. Item 36 looks at the accessibility of those services across the state, and then item 37 looks at whether those services can be individualized to meet family needs. So again, looking at where it's working well, in states that performed well in item 35 specifically, utilizing the concept of wraparound as a way of coordinating and delivering services has really proven to be effective. They've built strong connections with their communities so that they broaden the array of services and they're not just relying on state contracted services. Having access to independent funding streams to address specific service gaps, using family group decision making. Again, I think when they're using those meetings and they're identifying other resources that the family has available to them, such as relatives doing visitation or helping with transport, then they don't have to rely on their services only. So it really kind of expands the type of service and the way services are provided to families. And then in these states, they have a prevalence of specialized services to meet unique needs. So with domestic violence, substance abuse, and services for adolescent populations, those are consistently areas that are gaps that we see in states. So states that have targeted those areas have definitely demonstrated better performance for this item. So now that we have a picture of the key practice and systemic issues that influence both strengths and concerns in the outcomes, what I'd like to do in closing our presentation, I think I have 5 more minutes, so is talk about how states have used these findings to inform their program improvement efforts. And so I just want to kind of highlight some of the key focus areas that we've identified in the program improvement plans so far. And before I talk through them specifically, I do want to mention that we've seen a tremendous increase in court collaboration in this round of reviews. So not only in the on-site reviews, we've had judges participate as reviewers and really get involved in the planning with the courts and really great partnerships. We're also seeing it in program improvement plans. So some states have crafted strategies specifically about how they're going to enhance their collaboration, and other states have just included the court in every one of the key strategies that they employ through their PIP. So just keep that in mind as we talk about some of the focus areas. And the other thing I also wanted to mention is that states have utilized technical assistance in various ways in implementing some of these key strategies and focus areas. So some of the things that we've been able to identify as we look through the PIP's practice models. A lot of states have been implementing practice models both in a comprehensive manner that kind of span across all the practice areas, and other states that have just focused on safety if that was an issue that they really wanted to address based on their CFSR findings. Assessment tools, we've seen states develop and implement standardized and more comprehensive assessments of risk and safety, family strengths and needs assessments, and overall well-being assessments. So looking at children's education, their mental health, their physical health, but having a very comprehensive and standardized way for how those assessments are conducted. And then in addition to the tools, making sure that workers have adequate training as well as coaching to make sure that they're utilizing those tools effectively and not relying on them just as checklists, but having the tools inform their overall assessment of the family. Then a focus on strengthening worker contacts with parents and with children, but primarily with parents. So states have been revising processes and enhancing tools to locate parents, again, paying particular attention to fathers, using data to monitor contact with parents, and creating tools and guides to assist in ensuring quality visits. So helping workers identify what are those key issues that I need to talk about when I meet with a parent. And then again, family team meetings, which we've talked about. And you know, it really is interesting. A lot of states have employed some version of family team meeting or team decision making, and it doesn't necessarily mean that families are being effectively engaged. And so I think states are taking a look at how effective is this process in engaging parents. So just because we have a meeting, they're invited and they come, does that really mean that they were engaged? So states are really taking a closer look at that and figuring out what they need to do to really ensure the quality and make sure that parents have a voice through those processes. Then some other strategies and areas of focus: improving the use of data and their quality assurance and CQI systems and processes. States have been identifying key data sets that they want to monitor practice, educating their staff on how to use that data, sharing the data with stakeholders, specifically the court and service providers, ensuring that there's feedback and accountability within their quality assurance process, looking at how that data is being used and whether it's effectively promoting continuous improvement in their system. And then concurrent planning, which again we've been talking about a lot today, but again looking at, do we just have a policy or is it really being implemented? And so some states are trying to do some very targeted work around that. In-home services, a focus on that because of the differences in outcomes that we've identified in the reviews. Some states are really targeting some initiatives in that area, realigning staff so that they have more staff looking at the front end, reassessing their service array and making sure families have access to services that in the home, and then really making sure that the same practice standards that they have on the foster care side are being implemented on the in-home side. So worker contacts and the quality of assessments, that it's really even throughout both sides of the system. And then there's been some work around workforce development. Some states have looked at defining roles and responsibilities and competencies for staff, using data to inform performance appraisals, and then identifying training needs and working to develop really individualized worker training plans rather than just making sure that they're getting X number of hours of training, but really helping the workforce be better equipped to meet the needs of the families that they're having to work with. Then targeted permanency case reviews, and we're seeing this implemented in a variety of ways, but states are selecting kind of a target population, whether it be older youth with the goal of OPLA, children in care for extended periods of time, children who have special needs with no permanent caretaker identified, but they're identifying a special population based on their data and then having specific case reviews for those children, mining cases to find permanent connections, reassessing relatives that maybe at one point weren't interested and kind of going back out and reassessing that, and then doing targeted recruitment for children who have been in care for extended periods. They're also doing targeted case reviews at key points in time. So they're looking at kids who've been in care at 10 months and doing reviews around that, kids who are up for ASFA timeframes and doing reviews around that. Enhancing management and supervision was another key area in PIPs. I think states in this round have really recognized the importance of quality supervision. And so within that strategy, they're trying to improve communication within their management systems, having clear lines of accountability, and then doing a lot around supervisory training, helping supervisors focus on mentoring and coaching and clinical supervision, how to use data in their supervision. So really focusing some key work on supervisors has been throughout a lot of PIPs. Actually, we've seen that increasing. Then recruitment and retention. A lot of states struggle with placement stability, and so they've really taken a look at how do we help enhance what we're providing for foster families. So they're conducting surveys, conducting exit interviews, using foster parent advisory boards, all in an effort to better understand the needs of resource families and develop strategies then to retain them and to help promote placement stability. We've seen a lot of services being developed for resource families, specifically peer support, 24/7 access to assistance, respite care, so really targeting some of those services for resource families to promote stability and retention. And then finally, some work around the service array. There are a number of states moving toward performance-based contracting, really wanting to make sure that they're getting the kind of outcomes that they want from the service providers that they have contracts with, developing mechanisms for ongoing assessments of needs in the service array, developing more community-based services that are responsive to families, and then doing some work to improve their workers' understanding of how do you access a service array for families. It's really interesting when we go out on reviews and we ask workers about kind of what's available, and sometimes their understanding of what's available is very limited. It's just what they heard in training 5 years ago, and since then there's been a huge expansion of community services that aren't state contracted services, and so they're really just unaware of what's available. So some specific work around that we've been seeing in PIPs. And then improved collaboration with the public and private sector in providing some specific services, specifically around independent living services, transitional services for youth, mental health, and domestic violence services. So these were just a few of the things, the trends that we've been seeing in PIPs and things that we wanted to highlight for you all. This is ongoing work, and we've been really encouraged by the way that states have kind of been able to use their findings, do the kind of analysis that's needed to figure out what's going to work for their state specifically, and then really work in collaboration with their community to implement these strategies. So I hope the information was helpful for you, and I'll be around if anybody has questions later. Oh, if you have questions now, we can take questions now.
Hello, can you hear me? How you doing, Esther?
Hi, good
Mike
to
Grimes
see you,
from Kentucky.
yes.
And I know you probably can't tell me this, but I want to know who were the top 3 metro sites for permanency?
Oh, gosh. Yes. You know, when we did this presentation at the agency and courts, they did ask for that. And I know we have, I can't remember off the top of my head, but we can get that information. Any other questions that I have answers to? All right. Sorry? You took the top 3 for each item, so they're different for each item. Actually, I think in your notes it clarifies. I don't have it here on my PowerPoint, but I think it clarifies. They weren't